Hi, my name is Janet and this is Lifestyle by Janet. So today I'm here to talk about some few facts or points about COVID-19. So basically what the general public needs to know about COVID-19. As at the time this video is being filmed, that's the 4th of April 2020, there are over 1 million cases of COVID-19 worldwide. And then just yesterday, the CDC revised their guidelines to allow the use of cloth face coverings. Now, these are not medical masks. These are not the surgical masks or the N95 masks. No, these are just ordinary cloth face coverings to help in areas where social distancing measures cannot be enforced. COVID-19 is a respiratory illness caused by the novel coronavirus, and then this virus was detected in Wuhan, China in December 2019. Some people don't know this, but COVID-19 actually stands for something. So the CO stands for corona, the VI stands for virus, and then the D stands for disease. Then the 19 stands for 2019. That's the year in which it was first detected. So coronavirus disease 2019. That's basically the full thing. And some medical facts you need to know. The new coronavirus is in the same family as the virus that caused SARS some years back, and the outbreak of SARS some years back, and then MERS also just a few years back. It's also in the same family of some viruses that cause the common cold, and that's why the symptoms are kind of similar, not the same, but they're kind of similar symptoms basically. Before I continue, I think there are some dates you need to know. December 2019, that was when the virus was first detected in Wuhan, China. Now in January 2020, on the 30th of January to be precise, was when the WHO declared COVID-19 to be a public health concern. Now on the 11th of March 2020, WHO declared COVID-19 to be a pandemic. Now also another medical fact, males and females are affected equally. So don't think that the guys get it more than the ladies, or no, they're affected equally. Now worldwide, the top 5 countries with reported cases of COVID-19, the first on the list is the United States, then Italy, then Spain, then Germany, before even China. I mean, that's actually a turn. I'm going to explain as much as I can using non-medical terms what exactly this virus does to the body. I mean, for you to understand what it does, I can't really use a lot of medical terms. So bear with me if I still end up using some, because I mean, I'm a doctor, so yeah. So this new coronavirus infects some lung cells, which are called pneumocytes. So pneumocytes are specialized types of cells found in the lungs. And then the function of particular pneumocyte infects is to produce surfactant. Surfactants are just like fluid that help ease the tension in the lungs when gas is being exchanged. Compared to engine oil, when a car has engine oil that is gauged to the full level is meant to be, it functions well. When the engine oil is short, that is below the level is meant to be, realize that the car starts having problems. And then when there's no engine oil at all, the car is going to pack up. So kind of use that scenario to imagine what happens in the body. Now when this virus attacks the pneumocytes that produce surfactants are no longer going to be as available as they should, and then they start causing some breathing difficulties. That's basically what this virus does to the body. So now I'm going to talk about the mode of spread. The mode of spread of the new coronavirus is basically from person to person transmission, and then primarily spread through air droplets. So when a person talks, a person coughs, a person sneezes, the droplets can be transmitted to whoever is nearby the person. It's also said that the virus can last on some surfaces. So you could get it from contaminated surface or contaminated objects, and that's why they're constantly telling you to wash your hands, because even if you're not in contact with someone that has a disease, you could have touched something that the person came in contact with. Now there's also another possibility. There's also this theory that says that the virus persists in feces. That's feces. I don't think I have to use another word to explain feces. So if the virus truly persists in feces, then there's a possibility of fecal-oral transmission. That's from feces into the mouth. Not literally eating feces, but I mean, if feces can contaminate drinking water or the food in areas that have bad hygiene practices. So if this really is possible, then it means that the COVID-19 can infect someone else the same way people get cholera. But I mean, that's still a theory for now. Now, I've spoken a lot about the virus itself. Now let's talk about prevention. How do you protect yourself from coming in contact or from developing this disease? Hand washing. Number one on the list is hand washing. Hand washing, hand washing. Now, this could be with soap or water or with alcohol-based hand rub. Alcohol-based hand rub is aka sanitizer. The alcohol-based hand rub has to have at least 60% of alcohol. So don't go around trying to do your own homemade hand sanitizer without knowing what exactly you're getting into, because if what you're making doesn't have at least 60% alcohol, it's not going to be of any use at all. The second is social distancing. Now, the different guidelines out there are advising you maintain at least 1 meter between yourself and the person next to you. That way the droplets from the person's mouth or whoever's mouth, whoever is around you, will not come in contact with you. The third, avoid touching your face, they say. So avoid touching your eyes, your nose, your mouth. I know it's difficult to do, but try and avoid it, at least for this period. Fourth is practice respiratory hygiene. Personally, I'm not a fan of telling people to cough or sneeze into their elbows. I mean, if I see you doing that, I'm going to stay away from you, because that's just gross. Imagine coughing. I mean, when you cough, mucus comes out. Imagine doing all that into your elbow. No, that's not hygienic at all. What I would advise is carrying a pocket tissue around with you. I mean, this is not expensive. This is 15 naira, I think. This is 15 naira. So you can buy the whole roll, carry a pack around with you. When you want to cough or you want to sneeze, just bring out one tissue, cough, sneeze into it, and then discard it. Don't reuse it, discard it. And then this is not the time to be carrying around handkerchiefs, because I mean, you can't keep reusing handkerchiefs in this period. So don't carry around handkerchief, just carry pocket tissue and then use it judiciously. Now, the fifth is, if symptomatic, seek medical care. Don't self-medicate. Don't experiment with drugs. Seek medical care. Go to a clinic, go to a hospital, call your doctor, however way you want to do it. Seek medical care. Now, you notice in the prevention of COVID-19, I didn't talk about face masks, and that's for a reason, because that's going to be in another video. There's some myths that have been spreading about COVID-19, and I'm going to bust those myths. The next is the classification of COVID-19 based on symptoms. I'm going to talk about the classification from the least severe to the most severe category. So the first is the asymptomatic. That's the least severe. At this stage, the person is not showing any signs. The person basically appears healthy. There's nothing at all wrong with this person. I mean, a lot of diseases have this stage. Take malaria, for example. If I test you for malaria, it's likely going to be positive, because I mean, if you're in Nigeria, that is, it's likely going to be positive, because Nigeria is an area endemic with malaria. Doesn't mean you're going to fall sick now, requiring you to take anti-malarials and all that. No, it's in your bloodstream. It's when the parasites overwhelm you, then you begin to show symptoms. So that's basically the same way it is. And another example is herpes. Some people tell you that, oh, they think they're about to get sick because they have some, or they think they're having a fever because there's a sore on their mouth. Nah, bruh, that's herpes. What happens is that the virus is in the person's body, so the person's immune system is a bit weakened, and then it just comes through, and that's why they start having the sores on their mouth. And then without any treatment or any other thing, it goes off on its own when the person's immune system is better. This is how virus basically behaves. So the asymptomatic stage is really nothing to worry about. Now, the second stage is a mild stage, and then this is where the person basically has flu-like symptoms. So some mild headaches, some low-grade fever, some coughing, some tiredness, malaise generally. This is where the person has these symptoms. The third is the moderate stage. Now, think of all the things I mentioned in the mild stage. Now, increase the tempo just a little bit, and the fever becomes a high-grade fever. The coughing becomes more persistent. The person becomes more tired, more unwell, and this is the stage where the thermometer can now pick up that this person actually has a temperature. This is where those infrared thermometers kind of pick the person up, because at the mild stage, I mean, if a person has like a fever of like 37.3 or 37.2, people are going to tell you to just walk right by, because most people are working with 38 degrees, and that is where the moderate stage comes in. The fourth stage is the severe stage. This is when the person has a full-blown pneumonia. So the person starts experiencing respiratory distress. The person finds it difficult to breathe. Breathing becomes like a task for this person. Struggles to breathe. Is tired when he or she is breathing. It just becomes a lot of work to breathe. And at this stage, the person is probably in the hospital and then would need oxygen, because the person cannot continue struggling to breathe. So you have to supplement this person's breathing by giving the person oxygen. So that's the severe stage. Now the last stage is the critical stage. Now everything in the severe stage kind of multiply it by 2. At this point, the lungs are basically failing. Now this is the stage where the person will need a ventilator. A ventilator is just an artificial breathing machine. So at this point, the person cannot maintain respiration by his or herself. The person will need a ventilator to help him or her breathe. So that is where the person needs a ventilator. And then at this stage, the person is likely to have a sepsis, and the infection kind of leaves the lungs and then spreads through the rest of the body, and then it becomes like a generalized illness. Also at the critical stage, because the infection has left the lungs and spread through the rest of the body, other organs are going to be affected. So aside from your lungs having a problem, your kidneys might start shutting down, your heart might start having problems, and then if you have a comorbidity as an underlying medical problem, it just makes everything more severe, more serious. I don't want to talk too much to make this video too long. I think I should end this here and now. I'm going to make another video talking about the medical management of COVID-19. So the treatments, the possibility of vaccines, the investigations that can be done, basically everything medical is going to be in another video. And then I'm also going to make another video talking about some myths, busting some myths basically, and then giving you guys the fact about COVID-19. You realize that in this particular video I didn't talk so much about masks. I'm leaving that for the next video about the myths. You don't want to miss that video. So at this point, I'm just going to say thank you for watching. If you learned anything from this video, if you found this video useful, kindly give it a thumbs up, kindly like this video, and also don't forget to subscribe to this channel, because there's more content coming your way. All right guys, bye for now.